The following segment is sponsored by Maryland Oncology Hematology. Their experts want every woman to know when to get screenings, how to do self-breast exams, and why it's so important to live a healthy lifestyle. Dr. Gupta, Dr. Magnant, we are so happy to have you ladies here to talk about such an important topic. And you guys have great information with your expertise. So Dr. Gupta, I'm going to start with you. We hear the terms mammography, ultrasound. Can you explain these to us?
Yes, absolutely. First of all, thank you so much for having us on to discuss these really important topics. Mammography is basically the gold standard of breast care and kind of breast surveillance. So basically, a mammography is an X-ray of the breast that your breast gets placed into compression in two directions, and then the radiologist can look at the tissue and figure out, does everything look normal? Are there masses? Are there cysts? Are there anything that we need to, any findings that we need to evaluate further? And the ultrasound is a test that for any of our women who are watching who have ever had a baby, the ultrasound they use on your belly is basically the same thing that they use on your breast. So if there is a finding on your mammogram, usually the next step that will take place is that you have an ultrasound performed to investigate that finding a little bit further.
Okay, so the mammography is where you should go first, get that done. How often should we get mammograms? When should we start? You know, there's always that information that we need to know.
Yeah, and this is actually a really important question. When we should start, there's been a little bit of a change in the guidelines that took place a couple of years ago, kind of muddying the waters a little bit. There was a guideline that was released saying that most women should start mammography at age 45. They had pushed that forward from age 40. Now, I'll tell you, most of us practitioners, especially in the breast world, while we don't ignore that guideline, we definitely recommend our patients start at age 40. We're seeing a little bit of an uptick in younger women coming to us with breast cancer. So we still kind of stand by the 40 and yearly guideline. That being said, the 45 guideline does leave a little bit of room for you to have a conversation with your physician about what makes the most sense for you and your risk and your life.
Right, everybody's different. Talk with your physician, get those guidelines. Dr. Magnant, we have the technology that you all use to help detect breast cancer, but we need to be self-aware as well. I'm a two-time survivor, and I found both my lumps through self-exam. So let's talk about how important self-exams are and how do we do one?
So as you know, self-exam is incredibly important. And the thing that we want to do in terms of self-examinations is we want to have patients do it so that they do it on a regular basis, approximately every month. If a woman is still having menstrual periods, then she should do it around a week after her period starts, when her breast tissue is the most normal. And the way I like to tell patients to do breast examinations, self-breast examinations, is to soap up their breasts in the shower and run their hands over them. And they're looking for something that feels different. Even patients will say frequently that they wouldn't know it if they found it, but they do know it when they find it. And it usually feels hard. It's as if your breast is a mound of clay with a pebble right in the middle of it. It feels rock hard. The other thing that's important to do for self-breast examination is to stand in front of a mirror and to raise your hands, put your hands out by your side, and then sort of like an airplane, and then raise your hands up and down and look at your breasts. And what you're looking for is, you're looking for lumps, something that stands out. You're looking for dimpling. You're looking for tethering lines, and you're looking for nipple inversion, where the nipple is starting to go in. Although nipple inversion can be normal many times, that's one of the things you're definitely looking for. So this is incredibly important, especially in younger patients where they haven't started having mammograms yet.
Such great things to remember there. So before I let you doctors go, what can we do to lower our risk? What can I do to lower my risk? What can women do?
So there's a couple of risk factors that you can't change, namely being a woman, but things that you can change are actually things that we should all kind of be doing anyway. Maintaining a healthy diet, maintaining a healthy weight, not smoking. Collette, you want to go over some of the other ones?
Yeah, and so the other things is what we know is that regular exercise decreases your risk of breast cancer. And as Dr. Gupta said, a healthy diet and a healthy weight. Maintain a healthy weight. The other thing in terms of the diet, the most important thing about the diet is to have healthy protein, non-fatty protein, and then add in fruits and vegetables of many different colors. And those are the things that you can do. You can't prevent breast cancer, but you can certainly lower your risk by being healthy.
Well, Dr. Gupta, Dr. Magnant, thank you both so much for all of this information and getting this conversation going once again for us to be self-aware of our own health. Thank you so much.
Thank you
very much.
Such great information for all of us. And for even more, you can visit MarylandOncology.com.